I'm Dr. Jerry Hesch. I'm a orthopedic manual physical therapist. I treat the person, and I work with the body as well. And I treat movement, I treat micromotion. My client is doing much better. It would take him up to an hour to get out of bed. He just was so stiff. Sitting and driving was bothersome. And what else?
Standing, walking.
Yeah.
Yeah.
So what I treated on him on the first day, this is his third day, I only see people 3 visits, was he had what we call a sacral torsion. Some people get all excited when you even use that terminology, saying it doesn't exist and you're harming people by telling them they have that, blah, blah, blah. Well, whatever it is, I found blocked movement on the left lower quadrant of his sacrum, okay? I'm not saying that happens inside the SI joint. What I am saying is that it does block motion translating through the SI joint. So it could be a twisting of the entire pelvis such that the lower quadrant is the focal point that becomes prominent and that lacks motion. Whatever it is, my treatment is very simple. It took 2 minutes. He came back yesterday, comes back today, it's gone. He's much better. And I taught him how to self-treat that. So I call my approach once and done, and we can argue till the cows come home about what I'm actually doing, but I am helping people with this approach. So it is what it is. I don't tell people it's your SI that's out of place. I don't go there. So anyway, that piece is taken care of. Now, most people, if they have faulty tracking in the joint above the SI, so this is where, the articular surface of the sacrum is, so this is part of his sacroiliac joint. Right above it is the lumbar facet. So the sacrum has these 2 little facets here, and the L5 comes down and it makes the lowest joint, right? I've observed these for 40 some years, and the typical pattern when someone has the pattern of the sacrum that I described, or the pattern of the pelvis, is that when they bend forward, L5 will rotate left and side bend left, but that's not the case with him. When he bends forward, he has complete symmetry. When he bends backwards, go ahead and bend backwards, give me a little arch there. So here's his PSISs, here's the top of the pelvic shelf. This should be L4-5 junction, so this should be 5. If this is PSIS, this should be S1, so that both roads bring me to this being L5. What happens was he has increased muscle tone on the left side. My left thumb sticks out. I'm not worried about the camera angle, just listen to the concept because the camera's not going to really show you that asymmetry. But it's very distinct. On his right pair of spinals, I can indent them. The left ones, I cannot. Now, he must have developmental asymmetry of the facet joints, which is somewhat common. More than 30% of the people have a different facet side to side, because I'm going to have you bend to the left side, okay? It actually corrects when he bends to the left side. So to treat him, we need to have him side bend left, but we want to have him then rotate right. So twist your body to the right, beautiful, okay? So what I want you to do now is just lean on your left hand. Yeah, very good, okay. So we've stacked his motion. He's in extension. His lumbar spine is bending backwards. It's bent to the left side and it's rotated right. It's pretty rare for me to treat someone in extension for, faulty facet coupling. Faulty might not be the best term, but so be it. In other words, I treat most people with them being forward bent, side bent right, rotated right. Okay, but I'm pleased with my ability to discern the unusual. It might take me 2 or 3 visits, but I typically nail it. And so now that you've stacked 3 movements, all you have to do is introduce 1 movement and the other 2 follow suit. So I want you to just bend your elbow a little bit more. Good, yep. So now you're side bending a little more, come back up a little bit, go again. And the motion happens all the way down to the lowest mobile facet. So give me 10 of those, please. And you don't have to lock up motion. You don't have to pop the joint. You can treat it with motion. And from today forward, he'll be able to self-manage this. He won't need to see me again. Okay, whenever you're done, just straighten out. Sit up tall. Okay? And then I want you to bend backwards again. Good. All right, so I have my finger on the spot, and that's now symmetrical. So the muscle tone is now normal. So would you do me a favor? Would you walk up and down the hall once and come back and give me some feedback? And then sit in the chair. So I'm going to have him do this twice a day for about a week and do 10 of those twice a day. And then after that, I'll have him do it once or twice a week, and that should suffice. Your thoughts?
Just feel straight.
Nice.
Just straighter.
Nice. And try sitting as well, please.
Sure.
And how does sitting feel?
It's more comfortable.
Beautiful, beautiful. So I'm keeping your face out of the filming,
Okay.
just so you know. And I'll have you sign a release that lets me post this, okay? So I think it's going to be very easy for you to maintain this.
Okay.
I want you to do it twice a day for about a week.
Okay.
So you're just going to sit and bend backwards slightly. Yep.
And
Hold on. So first you sit and bend backwards. Okay, and then you side bend to the left, and you'll lean on your hand, okay, and then you're going to twist to the right just very gently. Nice, that's it. That's exactly it. And just like you did there, then you're going to do little tiny elbow bends, okay, and 10 of them in the morning, 10 of them in the afternoon or evening for about a week. I think that will retrain your body. You know, the body likes correction. Frank Lowen said that back in the 80s in Albuquerque. We used to trade work, and the body does like correction. You know, it just needs a little tweak, not a lot. And so then after doing this twice a day for a week, I would do it twice a week, just in case, you know, just in case you should strain it somehow or something. This is the way to get it back on track. So yeah, it's an interesting example of atypical motion coupling at the lowest lumbar segment. And some people say you can't palpate the sacrum, you can't palpate with reliability the L5-S1 junction. Rather than tell me that, and I'm familiar with the literature, ask me how, because one can train. Thank you very much.